Hello, Mighty Family. Welcome to the Second Opinion. My name is Dr. Eric Tam, and I am a board-certified family physician here at Mighty Health. Our goal here is to have inclusive and holistic conversations on all things health related to aging. Today, I am so excited to sit down with a good friend and colleague, Dr. Maggie Chen. She's a board-certified family physician who specializes in providing primary care for women. I'm excited for today as we're going to dive into all things menopause. So welcome, Maggie. How are you today?
Yay, thanks so much. I'm so happy to be here. I'm doing great. Happy to talk with you about this really important topic.
So to start things off, Maggie, what started your passion for women's health and what has brought you the most joy so far?
That's such a good question. Thanks. I went into medicine to do women's health. I started volunteering in a women's health clinic when I was in high school, and that's what led me to even want to pursue this whole career. And it's just been a thread all the way through. I think I really view women as the center of their families, and I think women's health is sort of undervalued or sort of underaddressed overall. So I really enjoy keeping that focus throughout what I do.
I love that. And really, we can't really talk about women's health unless we talk about the topic of menopause. You know, so many of our Mighty Health members are experiencing issues of menopause. So really want to just break this topic down, since I think even as doctors, we don't talk about this enough, or at least I know I don't. You probably talk about it a lot more. So we'd just love to hear from you. You know, what is menopause?
Yeah, I completely agree. I think it's one of those really under-discussed topics for sure. And I think women are just expected to figure it out, but it's really important to start talking about it more. We in the medical community define menopause as 1 year since the final period. You had your period and you had no further periods for a year. You've completed menopause. And that's just that part of the definition, but it's actually a whole spectrum that maybe we can get into a little bit more.
Yeah, I mean, there's so many stages of it, right? You know, perimenopause, menopause, some post-menopause. Break it down for us.
Yeah, sure. I think I would say that it's this, just at a baseline, it's this natural thing that pretty much all women will go through at some point in time. The average age that it happens is 50 to 51. It's really variable woman to woman. So when I'm talking to my patients, I have this discussion every day. I just say, don't compare yourself to anyone else. You know, you could have a very individualized version of it. And so, yeah, the perimenopause stage is sort of all of the time leading up to that final period once you actually complete menopause.
Yeah, and like you said, sometimes the symptoms can be so variable. You know, what would you say are the most common ones that you've seen and maybe the ones that have been most bothersome for patients?
Yeah, well, I'll turn my question back to you. What do you think is sort of the one in pop culture society that people talk about the most? They're like, oh, I'm going through menopause. What's the top thing?
It's got to be those hot flashes.
Hot flashes,
Those
yeah.
hot flashes.
Exactly.
Yep. You know, they're waking up in the middle of the night, you know, their PJs are soaked, right? And they just can't figure out why. And so oftentimes, you know, we're told if we're having night sweats, we're losing weight, it's got to be cancer. But oftentimes, it might be menopause.
Mm-hmm. That's such a good point. Yeah. So I think that hot flashes that sometimes they happen at night, sometimes they happen during the daytime. That's probably the most common one I hear about. There's a handful of other ones we'll go into as well, but I think when you see it in TV or movies, that's always what's portrayed. It's probably the most dramatic thing you could portray on TV. But I think you made a really good point too, which is that if someone is having hot flashes, it's really important to talk to your doctor and discuss if it could be something else that's not menopause. But let's talk about some other menopause symptoms too. So hot flashes for sure. I think the ones that people don't talk about are actually the vaginal symptoms. So vaginal irritation, dryness, pain with sex, those are things that people don't even want to talk to their gynecologist or their primary care doctor about, but you really should bring it up because it's a really common symptom. There's other ones too that can be a little bit harder to pin down, like mood changes. So some people as part of the menopause transition start having anxiety or depression, either for the first time, or maybe it's happening again if it happened before, or maybe it's getting worse from what they already had.
Yeah, just based off of what you said, so many questions popped up in my mind and really so many concerns. I think, you know, the one right off the bat is, you know, how do we as providers also create that safe avenue where they can bring up some of the more sensitive symptoms, right? Like you mentioned, you know, vaginal changes, right? Pain during sex. What are some techniques or kind of ways that you've helped, you know, patients just feel comfortable to have that direct line of communication with you And also, what do you think, can help empower women to just be more forward to really endorse those symptoms so that they're not just getting overlooked out of the discomfort of talking about them?
Yeah, like the societal discomfort. I would say that from my end of things, what I try to do is start talking about it early. So starting maybe early 40s, mid 40s, just really keeping the door open and saying, hey, do you have questions about menopause? What are your friends talking about? There's oftentimes sort of little whispers or small stories that are passed through women in a family about how it was nothing or it was terrible, any version of that. So I like to at least open the door because otherwise I think that patients may or may not feel that comfortable bringing it up. But on the flip side, I would also really encourage patients to start asking questions early so that you're prepared when it starts happening and it's not a total surprise and you're not caught off guard by what's going on.
I love that, because just kind of that anticipation also gives them a heads up. If those symptoms do start to come about, they're at least, they have in their mind what it could potentially be, right? And I think the other thing too is like, patients should always feel empowered to really tell their doctors anything. I think some patients are like, oh, I didn't want to tell you about my feet because of X, Y, and Z, or I didn't want to gross you out, but really like, we're here for it. That's what we're all about. And so much of it is just, we're here to listen and then figure it out together, right? So I think that's just a huge statement there where, patients should feel empowered to tell us, anything that's changing about their health, both physical and mental. But I think in addition to that, it's definitely on us to create just a safe, welcoming environment where that communication feels right and comfortable. The other piece that you were mentioning is really the mental health piece of menopause that I don't think we nearly talk about enough, right? And sometimes it can be hard to tease out, like you mentioned. Someone could just feel brain fog because they haven't, been getting enough sleep. They may feel a little depressed because they have a lot of things going on in their life, So I think those symptoms can be so challenging because they're so non-specific. Has there been ways that you've been able to ask of your patients to help better tease out whether those are related to menopause or not?
Yeah, definitely. You're totally right. It can be hard to tease out. I think that what you were just asking about really touches on why we both love being family physicians so much, which is that continuity. So it's kind of impossible to diagnose, to tease apart, is this depression happening on its own? Is it related to menopause if you just meet someone once and never see them again? But what's really nice about the long-term relationship that we have as family physicians is seeing them once, have that initial conversation, track the symptoms, do some screening questionnaires, see how they're doing maybe just 2 weeks later, 2 to 4 weeks later. Because all of these diagnoses, they actually, especially some of the mental health diagnoses, they depend on you having persistent symptoms over a series of weeks, whether it's 2 weeks or longer. And so I would say sort of taking it step by step, and for patients to not going in, expecting to be able to just get diagnosed immediately in that moment, but it might be a little bit of a process and then getting there eventually.
Yeah, I think, something you mentioned is almost like journaling your symptoms, right? Keeping like a diary. Mm-hmm. And that in itself, I think, is such a great management tool because, from our standpoint, we may not have the answer that day, And like you said, sometimes patients come in and they want something, right, to be figured out, to be diagnosed, but they also want to feel like they're in control. And in some ways, journaling, I felt like, is almost a way where there's a solution for both of us, where for me, it's a mechanism to get more data points, get a better idea of what's going on. And from their standpoint, they feel like they're in control because they're actively, logging what they're feeling. So I just want to say I love that idea, and I use that all the time in my own practice. In terms of just,
I want to touch on that too.
Yeah, please. Do it.
I think that just to kind of like pull back the curtain of us as physicians, our thought process, we really depend on some of those details that come out of journaling. We really depend on knowing how frequent are the symptoms, when did they happen, what were the factors that were associated with it. So to sort of, from the patient education standpoint, if you can come into your visit already having a lot of that, or maybe have it at the follow-up visit, that's very important to us to be able to give you a clear diagnosis and figure out the treatment plan.
All right, now I just want to add on to that because
yeah,
I feel like so many patients are also hesitant to bring almost like a shopping list of things that are bothering them, or they're almost hesitant to bring up information But I think that's like the best thing. Like when my patients come in with a shopping list of things they want to address, I feel like that makes my life so much easier, because at the end of the day, like I'm trying to meet you where you're at and solve what you want to get addressed. But all right, we're getting a little sidetracked here. So much more to unpack with menopause. I think one thing that a lot of people always ask me in my clinic is when is it time to start treatment? When are my symptoms severe enough for me to maybe start some hormone therapy or other things like that? Is there a gauge that you use to kind of make that decision?
Oh yeah, absolutely. It's same thing as what the menopause experience could be. The approach to treatment should be very individualized and really focus on that specific person. I think that anytime the symptoms are getting in the way of your functioning, getting in the way of you living the life that you need to live, keep up with your daily responsibilities, really potentially causing a lot of suffering, absolutely treatment should be discussed. I think it's a little bit different if maybe the symptoms are showing up here or there, they're not that frequent. You can manage them with sort of more lifestyle or environmental changes, like for example, to manage the hot flashes by changing clothing or changing fans, that kind of thing. But anytime a patient's concerned, we should at least be having that discussion with them.
I love that. And the key thing is it's so individualized, because I've had patients where it's like, oh, menopause really wasn't that big of a deal. Other patients, it may be, one of the worst experiences they've had thus far, right? So the individualizing, of that treatment process is so key, so key. I think one thing that I've noticed patients are always bothered with is probably the weight gain that can come with, the menopause. Wanted to hear your thoughts on how you go about, addressing that issue if patients were to bring it up.
Yeah, for sure. I mean, the weight gain is not a guaranteed thing that's going to happen. And you and I keep talking about this sort of full spectrum of menopause might just happen and you might not even notice it's happening. It's not that common, but it does happen. And then there's this whole other spectrum where there's very intense suffering and lots of really ongoing pervasive symptoms, and people could fall anywhere in there. I wish that there was some kind of magic thing we had that would just, oh, we'll give you this thing and you won't gain weight in menopause. But fortunately or unfortunately, it just really comes back down to those fundamentals of focusing on nutrition, focusing on exercise, and then getting all the supports that you might need around that, whether it's your own plan, whether it's the apps or the programs that you're using, getting nutritional counseling, getting coaching around that. Yeah, there isn't sort of some other special thing that you can do to treat the weight gain for menopause. Of course, we do want to treat the menopause symptoms, so there are some specific treatments we would use in that case.
Yeah, should we dive into some of those treatments? I mean,
Sure.
I think our brains naturally go there just because of our medical training. Our listeners may be bored by this, or they might be excited by this, just to kind of know what's out there. And I think, with that said, most common that people probably hear about is just hormone treatments, right? For particularly just what we call vasomotor symptoms, which is kind of, we talked about earlier, the hot flashes, the anxiety, the heart palpitations. This is one area where estrogen or just really combined hormonal therapy can be effective. Obviously, Maggie, you have so much more experience using them. Would love to hear how you think through starting hormone treatment for folks.
Absolutely. I definitely want to talk about hormone treatment. I also don't want to skip over the fact that treatment doesn't always mean medication. Sometimes it does, but it also means, really just backing up, like we were just talking about the fundamentals of what's happening with nutrition, what's happening with exercise, but also, what is your sleep hygiene? Like, what is your sort of approach to sleep? How can we optimize your sleep? What's happening with your stressors in your life and your social and your family situation? Paying attention to all of those things and sort of treating those aspects in and of themselves are treatments for menopause. It's not all about medication. But yeah, hormonal treatment, it's become sort of quite controversial over time, and there's been big swings in the medical practice and sort of societal understanding of hormone treatment. But if we think of where we are today, 2023, using hormone treatment to help people with the bothersome symptoms through the menopause transition is really a safe and acceptable approach. If patients are having those symptoms you just mentioned, we really should be talking about if that's the right option for them and really bringing it up.
And, kind of what you did just before even talking about hormones is just taking that step back, right? Oh, I love that so much. Really, because, it almost seems like this is that chapter in their life that almost allows for a deeper conversation about a bigger reset. Because just kind of with life, right, it gets ahead of us. We get busy, work, children, that sometimes we just forget to take care of ourselves in the process. I found that, when my patients go into menopause or experiencing that, that just almost allows for so much more of a holistic conversation about things in their life that they can also tackle at the same time while addressing these symptoms. I even think about the women in my family, right? It's always family first, children first, that, they forget to take care of themselves in the process. But when menopause comes around, that's like a perfect segue for, hey, like, what about you? Like, we got to focus on you. So just want to make that comment there.
That's I'm going to take that. I'm going to use that approach of like, this is a really good time for a holistic reassessment and a reset of sort of the whole prioritization and what's been going on. Mm-hmm.
Yeah. And just kind of on the same topic of being holistic, I know there are many people out there that don't want to take medications, right? And it's not always about taking medications. I think the question for you is, have you found anything, in the supplement rounds or kind of the herbal medicine realm that may be beneficial?
Mm-hmm. Yeah. Wow, the supplement world related to hormones and menopause is wild. There are so many options out there, some of which might be helpful, but a lot of them I think probably are just a lot of marketing and a lot of, companies trying to prey upon people who are struggling and, want them to take the supplements. But as you and I both know, we really try to focus on the evidence, and we try to really focus on recommending things that there's good data behind it, and we can really feel strongly about that recommendation, that it's really based in the evidence. And unfortunately, with all of the herbs and supplements related to menopause, we don't really have any that have met that criteria of, yes, this one absolutely is worth considering. If it's a herbal or a supplement that's thought to be relatively low risk in terms of what they're taking, and it's from a reputable manufacturer, I think, I'm open to patients trying it if they'd like to. Same thing with some of the integrative medicine approaches. We don't really have a perfect study to say, yes, menopause is evidence-based, and acupuncture or some of the integrative medicine approaches is evidence-based, and, absolutely everyone should be using it for menopause. But have I seen patients who have really benefited from using Chinese medicine approaches through the menopause transition? Yes. So again, it kind of comes down to that really individual approach and getting your doctor's opinion on what would be a good fit for you.
Yeah. And I think the key word is just safety. I think there is so much out there that really it's hard to keep track of. But I think, first and foremost is creating that rapport with your patient where they feel comfortable telling you, things like that. Because some people, feel like their doctors are going to judge them, or they're going to, not believe in its efficacy and just not bring those things up. And I think, my strategy, or I guess my approach, is always to just have, first and foremost, great communication where they can bring those things up. And then if I don't know what that product is, like, I'm more than willing and happy to look it up, because my first and foremost priority is making sure that supplement or whatever it may be is safe. And, the second part is, if it's helpful to them and it's safe, who am I to say don't take it, right? Obviously, some of these products may be expensive, are not evidence-based, but at the same time, if it's providing some sort of, therapeutic relief, I definitely try to support my patients in that sense.
The safety thing, something I like to remind all my patients is that, the medications that we prescribe, you pick it up at that pharmacy desk, actually, it has your name on it and everything. Those are regulated by the FDA for safety and for what's actually in the medication. All herbs and supplements are not. So you never actually know, if you're buying something, does it actually have the thing in it that it says it has? Does it have any contaminants? There's been plenty of case reports where someone thinks they're taking something and actually has some contaminants or some other thing that ends up affecting them negatively in the future. So there's that FDA regulation component too, just to be reminded of.
And then, if we're going to talk about treatments, we also got to talk about more targeted and topical treatments even. So earlier you mentioned, the less comfortable symptoms that people, shy away from bringing up, right? Like the vaginal dryness, some itchiness that comes with it, pain during sex. Would love to hear from you, what type of treatments you offer in that scenario.
Yeah, absolutely. We have a couple of really great treatments, but one that is probably under offered is topical estrogen. So when we were talking about hormone replacement therapy earlier, we were talking about taking estrogen with or without progesterone, depending on the specific patient, that's going to go to your whole body. But taking topical estrogen is actually like applying a vaginal vaginal cream or vaginal tablet to the area, and it's almost like applying something to the skin. It's really is acting locally, and it's considered overall very safe and very effective for those vaginal symptoms.
Absolutely. And just kind of by the natural mechanisms of menopause, as the estrogen levels drop, we naturally get vaginal atrophy. And with that, with the skin breakdown, there's naturally going to be more dryness. There's going to be the symptoms of itching and things of that nature. So just trying to reverse that process with that topical estrogen is not only safe, but I found it to be pretty effective.
Yeah, I think one thing that also people don't think about is that women can get symptoms of a UTI or sort of urinary irritation, but it's actually all related to the menopausal changes and the decreased estrogen to the whole tissues in the area. So people will present to us saying, I for sure have a UTI, I for sure have a UTI, and it turns out that they don't, but it's actually that vaginal estrogen that they need to improve those symptoms.
Totally. And that point right there, if you are feeling, burning upon urination, increased frequency, increased urgency, it is very possible that you do have a UTI, just because the standpoint of, this is gonna get a little nerdy and a little sciencey, but with menopause, the acidity and I guess, alkaline nature of the vagina changes, right? And as a result, that makes you more susceptible for UTIs as well too. So UTIs definitely a possibility, but just like Maggie mentioned, a lot of the symptoms can feel like one, but not actually be it. Well, the next thing I want to touch on, and I want to make sure I'm respecting your time too, Maggie, is just kind of, in terms of, someone that is having a hard time with menopause, they're unwilling to, or not unwilling, but really don't want to try any medications. What is kind of your recommended follow-up with you to make sure they're doing okay?
Yeah. Menopause, like many sort of natural life transitions, it's more of a long game. It's not something that's like, it happened today and then it's over. It's really a years long process and transition that happens. So I think that I'd like to see that patient back within a couple months, maybe between 1 to 3 months, to provide ongoing support and to, like we mentioned, sort of the continuity factor, continue the discussion, keep tracking those symptoms, see how they're evolving over time, and keep the discussion going about all the different treatment options. We didn't mention there's actually a handful of other medications that are not hormonal that can be really helpful for the anxiety and depression symptoms, for the night sweat symptoms. So it's we have a whole big toolbox. We just don't really talk about it enough.
Yeah. I've had quite a few patients that I think one of the biggest symptoms from a mental health standpoint is just the anxiety that comes with it. And I know, we have in our arsenal many different, antidepressants that can be effective. Are there specific go-tos that you use, or your thoughts in general about using some of those medications?
Yeah, absolutely. I think it's important to remember that if someone's showing up with anxiety and depression that might be related to menopause, we use a lot of the same treatments that we would use if someone was having anxiety and depression but not going through menopause. We use, again, a nerdy moment, but we use sort of classes of medications, including SSRIs and SNRIs. They're mental health medications that change how some of the chemicals in the brain work, and they sort of transfer messages between the different neurons in the brain, and that can really affect mood and can really sort of improve mood and anxiety and depression symptoms too.
Yeah, and there's so much research backed by these medications too, which is great because sometimes and they also don't have to take it forever, right? I think that's like a big piece to mention too, because I think sometimes when starting antidepressants or anti-anxiety medications, people fear that they'll be dependent on it and may need to be on it for the remainder of their life, but just wanted to make that as a point as well too. And it's more like just something to help bridge you over this chapter in your life.
That's such a great point. It really is okay if you need to take these medications for years, for the rest of your life. That we consider that safe and okay. But when I'm starting someone on one of those medications related to mental health, I really tell them to think of, minimum 6 months, ideally thinking more about 12 months or longer, but not necessarily forever. We just keep reassessing and keep sort of seeing how you're doing.
And just the mental health piece, I think is just, something worth discussing more. Aside from medications, what are some coping mechanisms that you've found helpful for patients to deal with some of those symptoms?
Definitely. So aside from medication, I think one category we didn't mention yet is like the very important category of professional therapy. Getting a therapist involved. It's very different from talking to your friends or family because it's someone who's a trained mental health professional who's coming from a more objective standpoint and can really help you work out what's going on in your life or what's gone on in the past and have some of those really good structured ways of dealing with things going forward. So that's one for sure, is actually finding yourself a therapist and working with them. But then, the self-coping strategies. So all of those basics of what you're eating, if you're moving your body, who's your social connection, all of those things, they have a huge impact on mental health. And if you're not addressing any of them or you're sort of minimizing all of them, mental health is going to suffer for sure. So those are, going back to basics and going back to those fundamental aspects of your day-to-day life. Those are really the coping strategies I think about.
And just shout out to getting therapy. I think so often there's that hesitancy, even in my own life sometimes where I know I should reconnect with my therapist, but haven't made the effort to do so for whatever reason, right? But just recognizing how helpful that can be, especially in a time that you really need it. And like you said, it's different talking to a friend. Sometimes you need that objective third party individual that can really, provide feedback in a way that's unbiased, right? And then just kind of, the self-love piece I think is important too. I think we always talk about like lifestyle change, and like sleeping more, eating better. But I kind of just bundle that into this idea of self-love, right? Which goes back to you making yourself a priority and doing all the things that will make you feel better, that we often just forget. Well, all right, Maggie, we're closing in on the end of this segment. I just wanted to see if there's anything else you want to just, touch on today about menopause.
I think the big takeaway is just we need more openness and we need more discussion. There have been some recent, articles in the press about how it's under-discussed and maybe even minimized by doctors when patients try to bring it up. So I think that's something that would get us a very long way is if we can all together agree that let's talk about it more. Let's talk about it more within our families. Let's talk about it more if you identify as women or if you don't identify as women, we should be talking about it. And then the sort of related part to that is we have really great treatments. We have a lot of ways to support people and to reduce suffering during this time. So if we can actually talk about it more and get those conversations going, those of us in the medical community have the information and we're really excited to help people when we can.
I love it. I mean, there's no better way to end this segment than with that. Well, thank you so much for your time today, Maggie.
Thanks so much for having me.
For those that are not a part of the Mighty family just yet, check us out at mightyhealth.com for more. We're striving every day to be a modern, holistic home for healthy living.